The only certainty of human life is death. And we've all lost someone close to us. And we always end up thinking, was there something we could have done to save these lives? Especially the people we lose to suicide. We think so many people just giving up on their life. And we think that we could have given them strength to carry on. We collect the statistics, we count the number of lives we've lost. Our politicians come up with creative solutions like removing ceiling fans from hostel ceilings to prevent student suicides. So we count these statistics, but we forget to make their lives easier while they are still here. I'm Ishmeet Nagpal and I've been on both sides of this story. I've lost people close to me and I've almost lost myself. So today I'm going to talk to you about three things: mental health, disability, and empathy. So the discourse on mental health has been polarized to a great degree with stigma at one end and romanticization at the other end. I've heard people claiming that millennials are self-diagnosing themselves with mental illness just to feel included, just to garner sympathy. And a lot of people say that mental health illness is a privilege. To say that you're depressed is a privilege, because look at the people who are poor, who are starving, who are struggling every day of their life. They don't have the luxury to say that they are depressed. They think that mental illness is an upper class disease. But that couldn't be more wrong. Anybody can suffer from mental health disorders. Anybody can suffer from depression, from anxiety. And we just have to see it through that lens. But also, just because you have privilege or you have the monetary background, it doesn't mean that still you can access quality mental health care. It doesn't have to mean that you will be able to treat a mental illness well. Take my example. I come from a reasonably privileged background. I have 3 degrees, and yet it took me 10 years to finally even seek help. Because first I had to overcome my own bias. I had to get out of my house. I had to start earning on my own. Release myself from thinking, what will my parents say? What will my friends say? And then access mental health care. But even then, was it easy? After 4 years of 3 misdiagnoses, 4 psychiatrists changed, numerous medication changes, finally, at 28, I landed on the final diagnosis of borderline personality disorder. Now, the day I was diagnosed, my psychiatrist told me one thing very strictly. He was like, whatever you do, do not Google it. But of course I did, because that's what we do. So I went online and I typed in borderline personality disorder. And what came up was very disturbing. It basically said that there was no cure, that a large percentage of people who suffer from this disorder end up institutionalized, they end up taking their own lives, they end up not being productive members of the society. And there's a lot of stigma associated with it. Some therapists and mental health professionals outrightly refuse to treat this disorder, or they have no experience in treating this disorder, or even believing that the disorder is real. So the diagnostic criteria that I read, it had me very, very agitated, because you need to have 5 of these to be diagnosed, and I thought I had all 9 of them. Frantic efforts to avoid abandonment, a pattern of unstable, intense personal relationships, identity disturbance, impulsivity, mood variations and instability, chronic feelings of emptiness, inappropriate, intense anger, and transient stress-related paranoid ideation or dissociative symptoms. And as I checked off all of these, I came to another realization. A lot of the countries of the world recognize borderline personality disorder and other mental health disorders as a disability. Now, when we think of disability, we think of physical disability. We think of people who have an impairment. And admitting that I could be disabled forced me to overcome my own bias of thinking that saying that I am disabled does not mean that I am less than people. Saying that I am disabled would not mean that I can't do what other people can do. That I am in any way different from able-bodied, neurotypical people. And I had to fight really, really hard to accept this. But then, there is a difference, isn't there? So I had to look up what disability actually means. Now, according to WHO, it covers impairments, activity limitations, and participation restrictions. Though I felt that I did not have an impairment in a body function, I did feel that I did have activity limitations. Now, for example, completing an assignment for college. It's a task. Most people can complete it. They might worry about it, they might copy from others, they might leave it till the last minute, but they do it. They submit it. And it's a way of life, especially in engineering colleges. It's a way of life that you wait till the last minute and then get some help from the seniors and you do it. But the same task for a person like me would amount to feeling suicidal on the night before. Would amount to thinking that I'm not good enough. Would amount to thinking that I can't do it and completely shutting down. So yes, I felt that I did have activity limitations. Participation restrictions. Normal situations in life. Your boyfriend or girlfriend's birthday. Easy enough? Some pressure. What will you give this person? Where will you take them? How will you surprise them? For me, it would become a life and death situation. It would become thinking about whether this person actually loves me. Do I love this person? This is too much. Shutting down and sometimes disrupting the entire day and spoiling it. Spoiling family occasions, spoiling family relations, and just not being the person who can just go to a social gathering and have fun. Participation in board meetings, participation in events like this, going up on a stage and speaking, preparing for this event. I did not prepare. When we see disability, we feel like this is a burden. When we talk, even in public health terms, because my post-graduation was in public health, we talk about disability-adjusted life years, the number of years lost to a disability. We talk about the burden of mental illness on the world. We talk in these terms because we measure success and productivity in a very numerical way. I read today that there is a position at Walmart called greeter, where people with disabilities found good avenues of employment, where they had to be at the gate, welcome people, see them off, and a lot of people with disability, even people who were wheelchair bound, found this a great job. A lot of them are employed there for up to 20 years. But now Walmart decides that this position will be called a customer host, and that these people will now have to lug shopping carts, lift heavy weights, check receipts of people so that they can catch shoplifters, and effectively eliminating people with disabilities from this job. Now they have come out with a statement saying that we will readjust these people at different positions in the store, we'll try to accommodate these people in other positions. But effectively you are saying that this job cannot be done by people with disability, and you wouldn't be wrong. They are worried that they cannot catch someone shoplifting because that person will just run away. What will we do? And they are fighting. They are fighting for Walmart to recognize that instead of looking at productivity and numbers, look at the human aspect. Which brings me to empathy. We are a consumer-driven, capitalistic world. Some disabled people need to even drop out of the rat race altogether because they feel that it has no time and space for them. And now when you think of invisible disability for people with mental health issues, what will they say? Now today when I came here, I told the organizers that I have another condition. I have dysmenorrhea, which means that I have extreme amounts of pain during the menstrual cycle. And which is why it is difficult to stand for longer periods of time, sometimes to even walk to the bathroom. And I asked them to have a chair placed for me at the corner of the stage in case I need to sit down, which I might need to still. So I asked them to place a chair here. And it was easy to articulate this, to say that I have extreme pain, backache, pain in my legs, so I will need a chair. I will need you to make some adjustments for me. Haven't we seen that before? When a child says that they have a stomachache and they don't want to go to school, don't you think there might be something else behind it? Maybe they're feeling stressed out at school. Maybe they're not able to articulate that they have anxiety and panic because of stressors and triggers at school. But because it's easy to articulate a tangible thing, it's easy to say that I have a stomachache. They're able to say that. Now, by no means is dysmenorrhea the condition I have which causes me pain during my menstrual cycle. In no way is this condition also widely known or understood. That's a conversation for another day, but in no way is it understood. But still, it is articulate to say that. How do I pinpoint or describe a discomfort for which we have not developed a vocabulary, for which we are not able to talk to people in our daily lives and describe it? Because you're perceived weak, you're perceived lazy, and you're perceived as a coward. But are we saying that this generation can change that? Are we saying that we can have the empathy and sensitivity to say that if I have an employee with a mental health issue, I will make their lives easier rather than depleting the quality of their life further? Are we saying that in colleges and schools, we can say that students who may not look like model students, they might have trouble maintaining their attendance, they might not be able to give their assignments on time, exams might be extra stressful for them because of their anxiety. Even though these students might be highly intelligent, hard-working people, are we ready to say that we are going to accommodate rather than stress these students further? A month ago, I started an international support group. Now this support group has 12 members, all kinds of gender, sexuality, race, different countries, different ages. In short, everything is different. Our access to healthcare is different, our economic backgrounds are different, and the way we've been pursuing treatment is different. But all of us have borderline personality disorder. All of us are bound by only one thing, and that is empathy, the ability to tell each other that it's okay, the ability to tell each other that we are not a burden simply because we cannot produce numeric financial results that look like conventional success. That we can tell each other that the love we have to give and the support we have to give to the people around us, what we are adding to the world, is enough. That we can accomplish something. That the world cannot say that you are not a productive member of society. One of the people in this group told me that it's very difficult for people to see invisible disability. They told me that for a neurotypical person, they start in the morning at 100 or a 90. But a person with mental health illness will start at a 20 or a 30 because they've already run 3 marathons in their head. We need to have the ability to tell each other that we matter. Despite everything, we matter, as everyone should. Thank you.